Hello, this is Nursing School. Today, we are going to focus on how you can prepare nursing care plan and how you can formulate the nursing diagnosis. My name is Patrick. Let's start together. By using example, we are going to formulate the nursing diagnosis and nursing care plan. Before we start the content of today, let me remind you about two types of nursing diagnosis. First type is actual diagnosis, which is also known as current problem the client have, while the potential diagnosis is nursing diagnosis, which are the risk, problem that are possible to the client when there is no measure taken is called potential diagnosis. With help of nursing process phases, read and respond to the following cases studies. Gabriel is a 20-year-old gentleman, is masonry assistant, still single and lives alone at home. He is sick since 1 week and is brought by his relatives to the hospital. He is admitted in medical ward in a district hospital and presents the following symptoms: physical weakness, fever, involuntary loss of urine, productive cough and difficulty in breathing, and also has pain on scapula. On physical examination and full assessment you notice that Gabriel has loss of both motor and sensory function of both lower limbs, paraplegia, and his vital signs: body temperature 39°C, BP 70-40 mmHg, pulse 104 beats a minute, RR 48 breaths a minute, and pain score for tenths, crackles in the basis of both the lungs by auscultation, necrotic skin wounds around the scapula, heels, and coccyx due to unchanged position that he developed at home, poor hygiene and foul smell from his dirty clothes. The better way of understanding the problem: first, we separate data. We have our care plan will start with the assessment. The assessment phase have two main parts, which are objective and subjective data. Assessment. Subjective data are data that are not observed, are patient report, while the objective data are measurable and observable by the nurse. Subjective data: 1. Physical weakness, 2. Fever, 3. Involuntary loss of urine, 4. Productive cough, 5. Difficulty in breathing. In objective data: 1. Body temperature 39°C, 2. BP 70-40 mmHg, 3. Pulse 104 beats a minute, 4. RR 48 breaths a minute, 5. Crackles in the basis of both the lungs by auscultation, 6. Necrotic skin wounds around the scapula. Diagnosis phase are phase in which nurses identify the actual or potential problem client has. When you are formulating nursing diagnosis, always remember the actual diagnosis has three-part diagnosis and its related factor, which are medical diagnosis and also its manifestation as sign and symptoms. When we are formulating the diagnosis, always we have to prioritize the possible diagnosis. The first nursing diagnosis is infective breathing pattern related to lung crack as manifested by difficult breathing. Acute pain related to tissue damage as manifested by the pain score of 4 out of 10. Risk for infection as manifested by necrotic skin wounds and poor hygiene. Impaired physical mobility related to loss of motor and sensory nerves as manifested by paraplegia of lower limbs. Self-care difficulty related to paraplegia as manifested by bad smelling. Impaired urinary elimination related to general body weakness or motor and sensory function as manifested by involuntary loss of urine. Impaired tissue integrity related to loss of motor and sensory function as manifested by necrosis of tissues on scapula. Let's stop here and join the next part. In the next phase of nursing care plan, we focus on plan of how we can resolve the problem we identify in the diagnosis phase. For example, we can say that I will relieve the pain from the 4 out of 10 to 0 out of 10 within 30 minutes and also restoration of breathing pattern within 30 minutes. During the intervention or implementation phase, I will implement my planning or goal with purpose of relieving the problem that I the client have. For example, we can say I administer prescribed medication and also I will place patient in sitting position, and in rational phase I will also explain why I was performed the previous intervention. For example, I will place the patient in sitting position with the purpose of restoring the breathing pattern. The last phase is evaluation. The largest action happened in the evaluation. You reassess the client with purpose of checking if the problem client has have been solved. Thank you for following Nursing School. My name is Patrick. Remember to subscribe, like and share. Let's meet together in the next video.